Well, ladies, September is Menopause Awareness Month. Hot flashes and night sweats are classic signs of menopause, but we're going to give you 5 unexpected signs next on Sonoran Living. Most women know that hot flashes and night sweats are classic signs of perimenopause, but many are not aware of the unexpected symptoms of menopause and that there is help to relieve these symptoms. Dr. Angela DeRosa, she is the founder of DeRosa Medical. She's here with us this morning with the 5 unexpected signs that you might be in menopause, and I love these. I love these. I know, surprise is right, and thank you for pointing out the things that we're not, so familiar with. All right, so when we're reaching over and borrowing our husband's shave cream, we might have a problem.
Absolutely. So our hormones tend to get very imbalanced during the perimenopausal time. So not only is our estrogen dropping, our testosterone's dropping, our progesterone levels are going all over the place depending on what time of month, but your levels get imbalanced, so we have to shave more, and we see a lot more of those dark black coarse hairs, which are very problematic. So when you're looking in the 3D mirror, and then you're going, oh, so you start plucking more. Definitely.
So that's on the face. Is that just on the face that we should be looking?
Typically it's on the face. You may also notice in different sensitive areas around the nipple, on the bikini line more, the hair growth is different, but also some women start to lose hair on their legs too, which is interesting. So again, shaving here, but not so much here.
Okay, so that's unexpected sign number 1. Number 2, allergies, if we're sneezing a lot more.
Especially this time of year, all the allergies are kicking up with those. But when we think about what drives allergies, it's not only what's in the air, but how quickly it can access our system. So in our nose, when our estrogen levels drop, that mucosal membrane dries up. It becomes very easy to penetrate. So not only do we get vaginal dryness, but we get dryness in our nose, which increases our allergies.
Interesting. Okay, the next one is mystery bruises, number 3.
So when our estrogen levels drop or become imbalanced, our skin gets much more thin. So anytime we bump into something, we're much more easily to bruise because we lost a lot of that collagen in our skin, which is estrogen. One of the prime roles in the skin is to keep that plump and healthy and pink and vibrant. So we become yellow, thin, and dry. So it's very easy to get bruised.
So if we're looking at something going, how did I get that? I don't remember hitting it.
Gently hitting something can sometimes set that off.
All right, now I have to say, I've been using a lot more Visine, and I kept thinking it was allergies, but it could be more serious.
Our eyes take a big hit too, because not, again, the vaginal dryness, the mucosal dryness, but also our eyes start to get dry, and the lens shape starts to change. So we may get more visual changes, but in particular, very dry, itchy eyes, which so you may need more Visine, or even in some cases, medications to help treat that.
Okay, and memory. I was just sitting here trying to go through the 5 with you, and I couldn't remember the 5th.
Yes, so when you get up and you leave the room, and I always say sometimes our brain might be in our behind at this point, because I go back to the room and I sit down and I remember it again. But estrogen, actually, if you think about it, is the communicator. It's the women. We love to talk, so it makes all the brain centers communicate with one another. But we also lose testosterone, which is the hunter. So it's that executive function thinking, remembering different things, such as reading a paragraph. You forget it, you have to reread it 4 or 5 times, and you still don't get it. But so our memory not only becomes foggy, but our executive function thinking starts to decline. So we're not as sharp as we used to be.
Wow. So, and that is in addition to the hot flashes and all of those things, and night sweats. All right. So we just listed a number of things that were very unusual. So thank you for that. How do we relieve some of those symptoms?
Well, certainly you want to balance those hormones back. So hormone replacement is certainly the be-all, end-all of treatment. So if you have a deficiency in estrogen or testosterone, replacing those back to optimal, normal levels would be ideal. And in some cases, let's say a patient is undergoing breast cancer treatment, and that may not be perfect for those scenarios. There's different things that you can manage symptoms. Restasis for the dry eyes, different vaginal creams for vaginal dryness, or there's different nasal sprays that you can be putting into the mucosa to help. There's tons of different options to manage different things symptomatically.
Is there a certain age where perimenopause is more normal? Because I started it very young.
Yes, so if you think about perimenopause, all peri means is around menopause. The average age of menopause is 51 years old, but the time frame before that is usually about a decade where we start to experience a slowdown of our hormones, and that's the ovaries making those hormones. So that's when that perimenopause typically creeps in. However, with the increase in problems in the environmental exposures, toxins, antibiotics in our diet, that age of menopause is slowly drifting, and I'm anecdotally seeing it now late 40s, which means women are typically now having the start of those symptoms late 30s. 20s. But there are also a subset of women like myself who went through menopause at 35. And although it's only about 10% of the female population, I started having symptoms in my 20s. So don't just say if you're young that you can't possibly have hormone imbalances.
All right, great information, Dr. DeRosa.
Thank you
So much. And we have put more information about Dr. DeRosa and menopause on our website, sonoranliving.com.